Welcome to the Biotech Startups podcast by Exceeder. Join us as we speak with first-time founders, serial entrepreneurs, and experienced investors about the challenges and triumphs of running a biotech startup, from pre-seed to IPO, with your host, Jon Chee. Our guest today is Amy Hay, Chief Business Officer at CTMC, a joint venture between MD Anderson Cancer Center and National Resilience, accelerating cell therapy development from discovery to clinical translation. At CTMC, Amy leads business strategy and partnerships, helping early-stage biotech companies navigate the complex journey from preclinical research to commercialization by providing end-to-end manufacturing, regulatory expertise, and clinical access, all under one roof. Before joining CTMC, Amy served as Global Head of Oncology Strategic Initiatives at Varian, a Siemens Healthineers company, where she launched Oncology as a Service, a global platform integrating medical technology, clinical solutions, and digital services to expand access to advanced cancer care. Under her leadership, Varian forged partnerships with Ayala Health in the Philippines and Christus Health in the US, generating more than $75 million in new revenue within the program's first year. Amy is also a founder, having founded Evolve International, a healthcare strategy firm advising leading cancer organizations across academic medicine, medtech, pharma, and digital health. With a master's in healthcare administration and over 25 years' experience spanning MD Anderson, proton therapy development, and global oncology strategy, Amy's career demonstrates how resilience, curiosity, and strategic partnerships can accelerate the future of cancer care, making this a conversation you won't want to miss. Over the next 4 episodes, Amy shares how her grandparents' influence, an early passion for helping people through crisis, and her father's advice to behave as if you're in your next job carried her from college in Texas through MD Anderson and around the globe to building partnerships that democratize access to advanced cancer care. She reflects on lessons from starting as a receptionist and patient advocate, raising $125 million to launch MD Anderson's Proton Therapy Center in the wake of 9/11, building the MD Anderson Cancer Network across multiple continents, and learning that you can't just plug in and play solutions across cultures, from Brazil to Nigeria to the Philippines. She also unpacks founding and selling her own consulting firm right before the pandemic, navigating the integration of Varian and Siemens, and why bringing manufacturing, regulatory, and clinical expertise together at CTMC can de-risk and accelerate cell therapy development for biotechs of all sizes. Today, we'll hear about Amy's early days growing up in Dallas, the influence of her artist mother and business-minded father, and how caring for her grandparents through dementia shaped her passion for supporting people through crisis. We'll also hear how she approached college with a photo essay documenting individuals at a Dallas food bank on Thanksgiving, her internship as a child life specialist at Santa Rosa Hospital, and why she realized she wanted to be part of healthcare, not just as a clinician. Lastly, we'll hear about her first day at MD Anderson Cancer Center in 1996 and how starting as a receptionist taught her to never say no, only how. Without further ado, let's dive into part 1 of our conversation with Amy Hay.
Amy, it's so good to see you again. Thanks for coming on the podcast.
Great to see you as well. Thank you, Jon. And I'm excited to have this time with you today.
Thanks for being so generous with your time. I know, you're very busy, so making time, I'm really grateful for that. And, really been looking forward to this. I know we've been kind of had this on the calendar for a while now, but a place we'd like to start, and we always think it's fun, is to really turn back the hands of time and learn a little bit about you personally and just like how you kind of found initial inspiration to do what you do. So take us all the way back. What was your upbringing like? What kind of formed your kind of leadership style and science and business philosophy?
It's always fun to kind of go back in time. I'll try not to rewrite history to make it sound more exciting. But I think I've always been very passionate about people and helping people. And, as a child, I had a very early introduction to healthcare and to medicine through our extended family. And as a child, watching my dad's parents suffer from dementia, and watching my parents take care of them and try to nurture them through that. And so very early on, I wasn't sure what I wanted to do, but I knew it had to do with providing some sort of assistance to people as they were going through crisis, and sometimes I tease about the comment of never let a good crisis go to waste, because on the business side, that's absolutely the case. But I think that's also the case on the life side, right? It's very easy to get bogged down into the negativity of a crisis, when I think that what we should be doing is focusing on how we're going to grow from that crisis in the long term. So as I was growing up, was very blessed in that I have, two wonderful parents, who are best friends and twins, in a way, and have a sister, but also had my grandparents very much involved in my life. Very different, I think, than most families in today's environment. I didn't have babysitters. I had my grandparents who lived down the street. And I was very fortunate to have that, because I think that it's really instilled in me this confidence of being able to do anything I wanted, and I was always taught, if you work hard and you try hard, you'll get there. It might take a long time. It might be a little bit bloody and you might be battered, but you'll get to the top of the mountain. You just have to work hard. And even in actually my very first job, which was straight out of college, kind of almost a receptionist position at a hospital, I did just that. I was very unhappy because I thought, I just spent all this time in college and I studied hard, and now I'm answering telephones and I'm checking in patients at the front desk. And my father called me and said, you know what you need to do? You need to behave in the way that is your next job. Pretend like this isn't your job today. Behave in a way that is your next job. And I've done that, I think, very successfully over a very long career. I've focused. I've never said no. I've only said how. And I think that served me well. And I only hope that I instilled that in my own kids along the way.
I was having a conversation with a colleague of mine too, who said something similar. It's almost like you're pulling forward the future when you do that. And he works at a venture firm, and in investing, there's kind of like a hierarchy to things and like what you're allowed to do at any point in time. But he was just like, I'm just going to teach myself and just do that next step now, and just try to be good at that as best I can. And it's kind of like, it kind of like creates this like momentum. And it doesn't have to be venture investing, or it could be anything really. So I love that. That's like an awesome kind of like, honestly, perspective on how you should, is perspective on like where you're at now and where you can be in the future. And growing up, and I had a similar experience. So I was raised by my parents, but also my grandparents as well. And part of my healthcare kind of like, experience, like early experiences, was taking care of my grandmother during dialysis. And that was the same thing, just like that just like really like sparked it. I was like, I want to be in like caring for people broadly in like healthcare, life science, as especially during crisis when people need it the most, is like this. It's kind of been seared into me. So I really empathize with that. And, while you were growing up, was there any kind of like, I guess, did you know that you were like, was there, from your family unit, were they like, hey, you got to be studying these things or this or that, or was it much more freewheeling kind of environment?
Yeah, it was much more freewheeling. But it's interesting because I do think that, in fact, actually very much formed me. My mother is an artist. I will tell you right now, I can't draw a stick horse,
Yeah, yeah.
and for years I thought this is so unfair. I have a mother who's an artist who creates things
Yeah.
and uses her hands. My father was in the business world. Um, and so for most of my early childhood, I couldn't identify with that artist side of my mom. I could only identify with my father in the business side. So that's the direction that I started heading. Um, the interesting part of it is that now what I realize is I had that artistic side the whole time. My artistic side comes in a different form. My artistic side is being able to put two things together that shouldn't go together and make it 10. My artistic side is how to, create new novel business structures or how to create new collaborations that others maybe would never consider. So I do think there's an art to that. And, while I didn't appreciate it when I was younger, I was surrounded by this artistic spirit of creation and then this business side. And I think I got kind of the best of both and melded it together.
I feel the same way, in that I was like, I wasn't kind of like stereotypically creative. Like, um, I love, I'm a big music fan. I listen to a lot of music, but I could not make music, nor, right. And so on and so forth. But I definitely see the kind of opportunities in outside of your kind of stereotypical like artistic realm where you can express that creativity and it manifests and comes about in a bunch of different ways. So I love that. And as you were approaching, thinking about going to college, kind of where were you like thinking of going? What were you thinking of studying? Like, take us back to kind of where your mind was at that phase.
It was really interesting. And I also think it's fascinating when I talk to, early adults now and hear about their college journey and the process, because it was completely different. And anyone that's in that 50-year-old age group will identify with me. There was two colleges I wanted to go to. One was in Puget Sound, and I'd never been there, but it looked gorgeous. And it was a small liberal arts. And of course, my parents were thinking, why do you want to go there again? Most likely because it was pretty and far away. The other was Southwestern University in Georgetown, Texas. Again, small liberal arts, but 3 hours from home. And I grew up in Dallas. I ended up going to Southwestern, and the ironic part of it is that, unlike today, I didn't apply to 100 schools. There was no electronic portal. Back then, there was a big envelope and you wrote it out hand. If you were lucky, you had a microprocessor that you typed your application on. And one of the benefits of Southwestern is they allowed me to not write a personal essay, but to do a photo essay. And at the time, I was very interested in photography. And that was kind of my mechanism in high school to try to have some of that creativity and hone in on it. So for my application to Southwestern, and I hope my mom still has it, but that's a good question for her next time. I did a photo essay on the food bank in Dallas, Texas on Thanksgiving morning. And I went down there and volunteered, and I took pictures of all these people. But I didn't just take pictures of these people. I visited with them. So I went over and I talked to them and I asked them their name and where they were from and what brought you here today and what's your story. And I then at the end said, would you mind if I take a photograph of you? And I compiled these pictures, and it was almost like a photographic journey of individuals that were finding themselves on Thanksgiving Day with all their belongings that they had in the world, getting a free lunch and chatting with a 16-year-old, 17-year-old kid, from the right side of town, who was generally and genuinely interested. Like, I wanted to know, how did you end up here? And what's next? Like, what do you want to do? And how can the infrastructure here help? So I think it was kind of a pivotal moment for me, looking back on it, because I was drawing on the art side, but then I was connecting with the people. So it wasn't just about the photograph. Anybody could take a nice black and white photograph that's pretty, but it was about what was behind the photograph. So that led me into Southwestern. Thankfully, they saw some opportunity in me. And as I went into my college years, it's a liberal arts facility. It's wonderful, small, and I focused on really all of the liberal arts side: psychology, history, sociology, philosophy, and just kind of surrounded myself with that. Ended up graduating with a major in psychology and minors in education and history, but it never really took me away from the person, the individual, the caring, the wanting to connect with another human. And while it's taken different formats over the years, that's kind of always been the underlying premise. And I think one other thing I would share is that my final semester at Southwestern, I actually did an internship at Santa Rosa Hospital in San Antonio. And it was a child life internship. And for those of you that are listening that maybe aren't as familiar, child life specialists are individuals with psychiatry, psychology background who work with kids in the hospital, and whether it's on trying to cope with the disease or the process or the treatment. And I got very focused on that. And it was really an opportunity to see how you could play different roles in healthcare, not just be a clinician or a nurse, which are unbelievably valuable, and those are tremendous people. But I knew I wasn't cut out for that. It needed to have another angle to it. And so that's really how I kind of left college, with that experience of being in a hospital, helping people, recognizing that I probably wasn't the right one to deliver the treatment, but I wanted to be part of it. And then steering myself toward how to do that in a really meaningful way that I felt good about.
I love that. And I think definitely I agree that, like, the healthcare, broadly speaking, I guess the most famous roles are kind of like doctors and nurses, but like I think all of us have, if you want to play a part, there are tons of we need all the help we can get. It's like, and everyone has something to contribute, regardless of kind of what your domain specialty or interests are. You will probably find an opportunity in healthcare broadly where you can provide value. I felt the same thing, like when when I was like, I gave it a shot. I was like, I'm gonna try to be a doctor. I was like, ooh, like,
I did too.
yeah, I was like, ooh, I don't got what it takes. Like,
Yes.
and that's okay. And that's totally okay. At least it's like beneficial to learn that early, because like that journey can be so long. And I have friends who are now practicing physicians, and they talk about, they're like, yeah, even like during the whole phase of like training, when you actually go practice, it's also like vastly different than like what you were like all of your training. So it's kind of like, holy moly, like this could be a 8-year journey where it's like, it could be, you'll never know. But during your undergrad, were there any kind of, I guess, were you doing any extracurriculars that you're involved with? And like, I guess, or were there any professors that perhaps took you under their wing or maybe gave you some inspiration?
Honestly, college, I'm very fortunate. College was just kind of this magical time. I ended up meeting my husband on the first day of college. So that was, kind of the start of my personal journey. In addition to that, I was really active on campus, part of a sorority, part of different clubs and that sort of thing. And I do think that's, in my opinion, like part of the really magical part of a liberal arts education as well. Yes, oftentimes my parents, kind of looked at me over the holidays and said, now, what again are you going to do when you get out?
Yeah.
But I came out of it with so much value across the entire spectrum that then allowed me to choose my path. I did have quite a few really incredible professors. Southwestern is one of those small liberal arts colleges where your classes are small enough that if you don't show up, your professor might stop by your dorm and knock on the door.
Yeah.
And so it's a very different environment,
Yeah.
and that just creates these very close relationships. In the psychology department, I had several mentors, one on the experimental side, Dr. Purdy, who, had a whole lab full of cuttlefish. To this day, I'm still allergic to cuttlefish.
Yeah.
Versus, incredible professors who, focused their whole attention on the Vietnam War. I took more classes in history, not because it was supposed to be my minor, but because it was just fascinating. And to look at these people who, devoted their whole life to really key points in history and educating the next, generation of that, I think that is just a, invaluable service to the rest of us. I mean, there's a reason why we often fail when we don't recognize that we're repeating history. And that's more relevant today than it's ever been.
Yeah. And, we have like short-term memory as people. So it's always like important to be like a student of history. If we want, kind of want to continue to progress, or if we'll just be stuck in this infinite loop. And so it sounds like you had a wonderful experience in your undergraduate. As you're approaching graduation, you mentioned your kind of like first role. Did you know what was next, for you, like as you were approaching?
Absolutely not.
Yeah.
So my senior year in college, my husband, Colin Hay, he was a year ahead of me. So my senior year in college, as I was about to go off to do my residency at Santa Rosa for Child Life, we got engaged, and he was a year ahead, so he was already in Houston and had a job. So teasingly, I said to him, when I graduate, I'm not coming to Houston of all places unless I'm engaged. So, forget it. I'm going back to Dallas. And I think that perhaps accelerated our engagement. And so got engaged. I had to, eat my words and move to Houston when I graduated. And I was really in a position of, what do I do next? I mean, there was no, at that point, and especially from where I was, I hadn't really gotten that far ahead. My next stop was Houston because I was getting engaged. That was it. And once I got to Houston, I needed to find a job because I needed to pay the rent. So, as I mentioned before, my first job was actually at MD Anderson Cancer Center. And that was in 1996. And I will never forget the day because it was the same day that Dr. John Mendelsohn started his presidency. And so during that day, of course, I was brand new. I was a child, and I was trying to, engage in the workforce. He was the president of the organization on his first day. We didn't really get to know each other until years and years later. But I told him this story that I remember sitting in the audience. It was, I think, Hickey Auditorium, and listening to him and his vision for the organization. And I was just in awe, listening to this man who was a scientist and a researcher and a physician. He'd already had life where he saved people's lives. He created new drugs. I mean, he had done things that I couldn't even wrap my head around. And it was his first day, and it was my first day. Completely different universes. And over time, I think that was kind of defining for me, because it made me realize that today is the first day of the rest of my life, right? It can be what I make of it. It can be something incredibly and great, and I can be so proud of it. Or it could be mediocre. And that's up to me. That's on me. And it really did kind of lead me to kind of these next steps. I stayed in that position for about a year, realizing, okay, I'm going to learn everything I can. I'm going to learn all of the IT infrastructure. I'm going to learn every system. I can still tell you, if you order a CT, you need a bun-in and creatinine. I tried to just suck in knowledge. And over time, the doctors and the nurses and the staff came to me for everything, because they knew that I would never say no. They knew I would just figure it out. I would say yes, even if I had no idea what the word meant, and I would go figure it out. And it's that type of kind of resilience that I think really helped me over the years in my career, even when things were bad, even when I had some tough calls or a bad break. It's that resilience that kind of keeps you going. So as I went through that first year, I immediately, as soon as I could, looked for the next position. And I took a position at MD Anderson as a patient advocate, which again went back to my roots. This is a group of people at Anderson who work in the clinics. They're there to support the patients. If you have a problem or a need or are struggling, how can we help you? Our job is to help you. So during that transition, I got the opportunity to really learn the clinical side. Everything from how do the clinics operate? How do patients go to surgery? How do patients get blood draws and chemotherapy? Not only from the patient's perspective, but also from the physicians and the nurses and all of the staff's perspective, right? Because at the end of the day, we're all human. We might be helping these patients with cancer that they're fighting today, but we're all fighting something, whether it's our health or whether it is a problem at home. I mean, there's always something. That's just the way the world, revolves. So I think I brought a different approach. At the same time, I also realized that there's a business of healthcare here. It would be lovely to think that you can get the best healthcare no matter what zip code you live in and no matter where in the world you live. And that's just not a reality, right? We had a CFO at the time that used to always say, no margin, no mission, which seems a little bit like painful, but it's kind of true. You have to have that business acumen to be able to really be visionary and provide new treatments and provide better care. And so there is a symbiotic relationship to the business of healthcare and, to the delivery and quality of healthcare. So it was at that juncture that I thought, you know what, I think I would probably benefit from getting a master's in healthcare administration, and kind of took that next leap educationally wise.
Yeah, I was going to say, like, the kind of just the earliest experience at MD Anderson of like always saying yes to opportunities and then getting the reputation. They're like, oh, Amy's going to help. Like, I need help. And like, I'm just going to tap Amy's shoulder. And I think that is such a kind of underrated way to just make yourself invaluable in any organization. Like, it really could be anything. Like, it's just having the willingness to just roll up your sleeves and not be kind of like turn your nose up to whatever thing it might be. I've seen it in my kind of career as well. It's just like, it's kind of the same things. It's like being, kind of being willing to take out the proverbial garbage or fold the laundry. will earn you a lot of honestly, it'll earn you a lot of cred internally with any organization. So I love that. And also I think you know, the CFO's comment about, kind of like we got to have this make business sense too, is kind of like, it's like when it does make business sense, it's almost like an accelerant to like, right, the innovation. That's not to, like there's plenty of stuff where, if and when we think about like academic research, there's like no margin kind of incentive there because it's academia and there's a place for that. But like, on the other side, like when you can make the business economics work for everybody, it just kind of gets like the machine going, like really, really going and really up to scale. Because I think sometimes, and I think that what I've noticed too is like sometimes the transition from academia into the business side, there's sometimes is things get lost in translation. Because, obviously, there's no requirement while you're in academia for that. And then what you can kind of go down a road where it doesn't make economic sense for a really long time. And then, you're like, oh, crap, like we need to figure out the economic side of this like quick. And sometimes you never figure it out. And it's like, if you could have kind of a general understanding up front of what it takes to make something make economic sense, it'll save you a bunch of heartache.
Exactly.
Later down the road.
Yeah, and it's interesting because, and I don't, this isn't even specific to any one organization, but one of the things over time that I think I've learned is that in these incredible institutions of research, the research teams think that they define the organization because of their research. The clinical patient delivery side thinks they define the organization. They're both right because they need each other to exist, right? And so it's that bridge that I think is key here, and it's not just key in delivery of, cancer care. It's really key in manufacturing. It's key in, the biomed business. It's the connective tissue that is required to make both the research and the delivery successful.
Absolutely. And I think we can, I used to be kind of like in one of the fiefdoms of like research, like, and, in early days, I was like, this is all that matters. Like, and you believe your domain is like the only thing, is the end all be all, but it really is exactly what you said, the connective tissue that matters, and kind of like bridging that gap and like reconciling the kind of the differences in approach where you find the magic. Because I've seen on the polar opposite ends of the extreme, when one rules, it has a whole host of problems on either end. So it's kind of this thing where you need to be able to toggle it for magic to happen. So you've gotten this like kind of early exposure, and you're like, there's something here that I need to kind of double click on and explore more and go back to school. Can you talk a little bit about your kind of grad school experience and how was that for you?
I think I did it a little bit the hard way, but honestly, I think it was probably the most valuable. I went to Houston Baptist in Houston, and I picked that program specifically because it was in Houston. And two, it was a Monday through Thursday, 6 to 9 p.m. at night program. So it allowed me to work all day and then go to school, but not have to give up, the weekends at least, but pretty much be, work to school 4 days a week. It was pretty grueling for about 2 years. And I think my husband, didn't see me for about 2 years. Yeah. But on the other hand, what it afforded me was that I was getting day-to-day practical experience. And so I was in, a program where I had people right out of college. I had people like me. I had doctors who were going back and getting a master's in healthcare administration. And I found it just really insightful and more valuable because I was learning about things that I could apply real time. It wasn't hypothetical. It wasn't just a book. It was me being able to say, okay, I understand that macroeconomic theory, and here's how I could apply that to diagnostic imaging. And it was real. right? And so, one of the things that I often tell people that are trying to figure out their paths is give yourself a little bit of grace to have some experiences in the workforce. And it doesn't matter if that is answering a phone or if that's in commercial or waiting tables. Give yourself that experience, because I guarantee you it will be valuable in applying knowledge as you move forward.
When I was younger, kind of like the early roles I had were in retail and kind of like hospitality.
Mm-hmm.
And at that point in time, I was like, these skills aren't like additive. Like that was like way back. But now I'm like, I look back on it and I'm like, oh man, was it additive? Like I still like, you can have like, how to handle when a customer's mad and yelling at you. And when I was like working the cash register at like a deli and just like an upset, like how do you handle an upset person? with as much, kind of like keeping it your cool as possible and be as diplomatic as possible. That's a skill that you can take anywhere. And same of just like being in hospitality is just like, how do you make people feel comfortable and taken care of? And kind of is like, again, a transferable skill, even if you're outside of that industry. So I totally agree with kind of that, kind of giving yourself some grace to experience it all. And that schedule sounds intense, by the way. Like,
it's kind of intense, but it paid off. I will say it definitely paid off.
That's all for this episode of the Biotech Startups podcast featuring Amy Hay. Join us next time for part 2, where Amy recounts her path from patient advocate to administrative fellow, how she differentiated herself by understanding every touch point of patient experience, and why empathy for clinical staff became her secret weapon. She also shares how she landed a role with the radiation oncology team, what it took to open MD Anderson's first satellite clinic in Bel Air against internal skepticism, and how that experiment shaped the entire MD Anderson network strategy that followed. If you enjoy the show, subscribe, leave a review, or share it with a friend. Thanks for listening, and see you next time. The Biotech Startups podcast is produced by Exceeder. Don't want to miss an episode? Search for the Biotech Startups podcast wherever you get your podcasts and click subscribe. Exceeder provides research labs with equipment leases on founder-friendly terms to support paths to exceptional outcomes. To learn more, visit our website www.exceeder.com. On behalf of the team here at Exceeder, thanks for listening. The Biotech Startups podcast provides general insights into the life science sector through the experiences of its guests. The use of information on this podcast or materials linked from the podcast is at the user's own risk. The views expressed by the participants are their own and are not the views of Exceeder or sponsors. No reference to any product, service, or company in the podcast is an endorsement by Exceeder or its guests.